formulating a plan to address Thunder Bay's homeless crisis. An initial draft was presented at City Hall last night. Good evening and thank you for joining us. City Council discussed a possible 100-unit temporary village to tackle the issue. It's part of the city's new 10-part homeless action plan, which hopes to address one of Thunder Bay's largest issues. Vasilios Bellos was at City Hall, and Vasilios, what else is in this plan?
Riley, it focuses on a human rights-based approach, which also looks at up to 3 possible designated encampment sites and a push for long-term housing solutions. It was presented as a first report, with a decision on the plan expected October 21st. A new proposal to address one of Thunder Bay's greatest challenges.
It's about survival and dignity.
City staff provided the first report on its 10-part human rights-based community action plan for homelessness during Monday's City Council meeting. It includes the possibility of 3 designated encampment locations, enhancing cleanup at encampments, and pushing for long-term housing solutions. But it was a possible temporary 100-unit village that dominated the discussion.
Massive cost for temporary housing.
Councillor Rajni Agrawal questioned the plan, feeling a $4 million price tag for the village, excluding operating costs, isn't a long-term solution. Agrawal believed using those dollars on propelling housing development as the best way to get people off the streets.
It'd be unfortunate for the people that are suffering, but I think long-term, full-term care at $80,000 a unit is worth looking into.
City Manager John Collin responded and agreed housing is the ultimate goal, but said with many projects still years off, administration believes this is the best solution today.
The question is whether or not this council is supportive of dealing with the needs of the homeless now and the corresponding impact on the community by not having effectively dealt with the homeless challenge until now.
A temporary village has been attempted in other municipalities, like Peterborough just last year.
I was just at a conference on Monday and Tuesday, and there's actually mixed results.
Councillor Brian Hamilton spoke of the Peterborough project and says operating costs can be around $2 million annually for their 50-unit village.
I'm seeing money from Homeless Prevention Fund and federal funds for upfront capital costs. I'm not seeing anything yet. Maybe that's something we could look at for in the report. Where are these funds going to come from? The operating costs are going to be substantial.
The final report will come to Council October 21st, where a decision on the plan will be made. During the meeting, Council also made a separate significant housing decision, approving $4 million from the Renew Thunder Bay Fund to accelerate housing development. It'll help build 130 new affordable and 114 market-priced units, as the city awaits more dollars from the Federal Housing Accelerator Fund. Vasilios Bellos, TBT News.
Construction of the $1.2 billion Waasigan transmission line can officially go ahead after the province approved the final environmental assessment. Hydro One Vice President Sunny Karanakaran says permits are being finalized and the work from Shunya to Atikokan should get underway in November.
The approval of the environmental assessment has come after a number of years of collaborative work with Indigenous communities, local landowners, municipalities, and a number of various project stakeholders. And it now gives us the opportunity to prepare for the next phase, which is to get moving with the construction of this project.
The Shunya to Atikokan line is expected to add an additional 350 megawatts of power to the region by the end of next year. But it's been a controversial project as homeowners along the route could have their land expropriated, meaning it'll be taken against their will if they don't agree to a monetary settlement. Hydro One says 80% of homeowners have agreed to settle voluntarily so far, and 95% have allowed early access for pre-construction work. But for the rest, who are still holding out, construction can begin without their approval.
Construction can and will commence. We have plans to actually commence the construction in early November and are going to be doing that.
Even though construction has already been approved, Hydro One has still scheduled 3 public open houses late this month in Atikokan, Thunder Bay, and Kaministiquia. Anti-nuclear waste activists showed up outside a Liberal fundraiser yesterday evening for a peaceful protest. They gathered outside a Northside restaurant to let local MPs and Federal Energy Minister Jonathan Wilkinson know that they should halt the potential underground repository near Ignace.
No to nuclear waste! No to nuclear waste! No to nuclear waste!
The members of Nuclear Free Thunder Bay and We the Nuclear Free North expressed their concerns about the site and the potential danger of radioactive material leaking into the environment and waterways. Nuclear Free Thunder Bay spokesperson Charles Faust says he wants Wilkinson to reconsider his instructions to the Nuclear Waste Management Organization to take charge of the location decision.
The federal government has abdicated its responsibility for anything nuclear. They let the nuclear industry do it because it's just too much trouble for them. And we think there should be arm's length panel that's in there keeping the nuclear industry honest.
We're not doing this for ourselves, not even for our children. We're doing it for our grandchildren and our great-grandchildren and many generations to come.
Wilkinson, who was in Thunder Bay for a federal announcement yesterday, didn't come out of the fundraiser to speak with protesters. There are more concerns about $10 a day childcare in this province. Some parents are being sent letters by operators who say it's becoming difficult to remain financially sustainable. CTV's Siobhan Morris has the story.
It's a program that's been helping parents with the heavy burden of childcare. But in the last few weeks, parents with kids in for-profit centers have been put on notice.
It was devastating to see a letter like that.
Letters warning their centers may pull out of the National Child Care Program, potentially doubling fees.
At that point, it's not worth it for one of my wife or I to work. What message is that sending for my wife? Because she would probably be the one to stay home with the kids.
The letters come ahead of a tweaked funding formula that takes effect in the new year. Some private operators argue it will leave them with less flexibility and decision-making power. While childcare advocates agree the transition isn't an easy one.
To go as far as saying, they're going to pull out of the program or close down a center or put parent fee reductions at risk, I think is not reasonable.
Fern says it's part of an organized campaign, putting pressure on governments through parents.
Let's keep the revenue replacement model, but let us raise our fees. Well, no, that's the entire point of what we're doing here.
Heather Kay wasn't entirely surprised to receive one of these letters from the center that cares for her 2 kids. But she's confused since there's been government funding to top up pay and reduce fees.
There's a disconnect here. I don't want to say who's telling the truth, but as a parent, it's hard to sort of get to the bottom of what's happening.
Governments are pointing fingers at each other.
Okay.
Ontario's education minister says she empathizes with parents and writes in part, Ottawa must provide more funding, lift the cap on for-profit providers, and give more flexibility so that providers can cover their costs and create necessary spaces. Meantime, Ottawa accuses Ontario of dragging its feet on announcing the funding formula and on creating new spaces. The federal minister firm on prioritizing not-for-profit centers, writing, "We've seen what happens when we privatize healthcare. It leads to increased costs, unequal access, and disparity in quality. It wouldn't be fair to parents or our children to let the same happen with our national childcare system." Not the kind of collaboration parents had been hoping for.
Parents need clarity.
We need all levels of government to kind of figure out, this existential crisis together.
Siobhan Morris, CTV News.
The Ontario government has lowered the age for breast cancer screening to allow women to self-refer once they turn 40. As Pauline Chan explains, this will give an additional 1 million women the option to get screened earlier.
Fernanda Dominguez Perdicaris calls herself a breast cancer patient in survivorship. She got a mammogram at age 49 by a fluke because her health was so good, her doctor said she didn't need to come in for another checkup for more than a year.
So that's why they said, okay, let's go ahead with the breast cancer screening now.
And when her ultrasound technician finished,
she said, I'm going to go get the radiologist to come in and talk to you. but I just want to tell you, I'm really glad that you didn't wait till you were 50.
But now, women with no family history of breast cancer and no suspicious lumps can simply ask for a screening.
Definitely, we are seeing breast cancer in younger women. It now means they can get an appointment without having to wait.
It's actually a win-win for women in Ontario. Not only do they get the chance to have their cancers found earlier, which gives them a better survival, it also lets them get treated with less aggressive therapy than when cancers are found later.
And Dr. Paula Gordon says it will save the province money.
The average cost to treat a stage 1 cancer is about all in $39,000. If a woman has a stage 4 cancer and it's HER2 positive, it could be over $500,000 per patient. Now you take that money and spend it on screening more women in the 40s, there are going to be fewer advanced cancers.
But Sidra Lone says all age restrictions for mammograms should be removed. She was just 38 when she was diagnosed this past spring after hearing several young colleagues were also diagnosed with breast cancer. Her first doctor said she didn't need screening yet, so she lied to a second doctor.
She was the one who asked me, do you have a family history? So I just said, I do.
It was a lie she says saved her life. 85% of breast cancer patients have no family history of the disease. Women aged 40 to 50 can now book their own screening appointment. Contact the Ontario Breast Screening Program for more information. Pauline Chan, CTV News.
Thunder Bay's 2 main school boards are seeing better results in the annual EQAO testing. That's according to the latest province-wide results from the Education Quality and Accountability Office. Lakehead Public Schools saw a significant improvement in nearly every category. 70% of grade 3 students met the provincial standard for math last year, up from 58% the year before. And for grade 6 math, the success rate jumped from 44 to 51%. Reading and writing results also went up in most categories. Meanwhile, the number of grade 9 students who met the standard for math went up from 49 to 51%. The Catholic School Board also saw improvements in grade 3 math, reading, and writing, but the numbers fell in grade 6 reading and writing and stayed the same for grade 6 and 9 math. Healthcare providers and educators from a variety of sectors met at the Italian Cultural Center today to share information about the needs of those living with fetal alcohol syndrome disorder. This year's session was the 22nd annual FASD training event hosted by Norwest Community Health Centers. Justin Hardy has the story.
170 health practitioners and educators took part in the annual training this year, led by fetal alcohol spectrum disorder specialist Donna DeBolt. The full day of training provided attendees with information on leading practices in response to the complex needs of those living with FASD. DeBolt says this year's attendees have been very involved in learning how to best support those with the disorder.
I think people are interested in terms of what their role is in this and how can they be important in the lives of people with this disability. And I ended the break this morning talking about placement stability, and that the most important thing we do for these individuals is let them stay where we put them. And I know that sounds pretty heavy-handed, but what I'm talking about is how do we keep them in families, and how do we keep them in schools, and how do we keep them in programs that they need.
Norwest Community Health Centers has hosted the annual training for 22 years. Maureen Parks, fetal alcohol spectrum disorder coordinator at Norwest, says with the ever-evolving research on FASD, it's important for healthcare providers and educators to make sure their understanding of the needs people have is also up to date.
There's more research, that's more research-based, higher standard of support, more well-known ways of supporting individuals with an FASD, but understanding that it takes a community, it certainly takes a village, and the reason that we have so many people in the room today is that everybody's hearing the same information, and we can provide similar support.
Researchers currently estimate that 4% of people across the country have FASD, with a higher percentage in this region. It impacts more people than autism spectrum disorder, cerebral palsy, and Down syndrome combined. Justin Hardy, TBT News.
Children's Centre Thunder Bay launched a new comprehensive education campaign today, focused on adverse childhood experiences, or ACE. The campaign is funded by the Ontario Trillium Foundation and aims to raise awareness and provide vital resources to mitigate the impacts of ACE in the community through various events and activities. The campaign will include free educational workshops offered throughout the region and one of the activities featured in the workshop is the brain architecture game. It has participants trying to build a brain that's as tall as possible. The game lets players understand the powerful role of experiences on early brain development. CEO Diane Walker says by educating the public about ACEs, they can create a ripple effect of positive change.
The ultimate goal from my perspective is to bring this knowledge and thinking to everybody in the community so we can really recognize that kids matter, young kids matter.
We're really hoping that people will think, feel, and learn about adverse childhood experiences in a fun, interactive, engaging way. It's a new way of learning. It's not a classroom style. It really is about bringing people together.
The campaign will run from now through 2025.